Hi, and welcome to Dr. C's Morning Minute. Glad you could be here. Today I want to talk with you about childhood anxiety disorders. Now, anxiety shows itself in so many different ways, but the bottom line feature is fear. The child is afraid. The child is afraid of going to school, of separation, of being made a fool of all the what-ifs that could possibly happen. The way we treat this is that you know the old adage, face your fears. But first, we teach the child coping skills so they know how to cope with the fear, typically through helping them to think differently about the circumstance, because typically there is a lot of catastrophizing, a lot of what ifs, and usually the what ifs are quite dramatic and alarming for the child. So we help them to think more moderately and more rationally about the situation. Then, it's again, face the fear. Sometimes it is progressive and slow, sometimes all at once, but the bottom line is we accomplish something referred to as exposure, which is exposing the child progressively to whatever it is, and sometimes, again, not so progressively, to whatever it is that they are afraid of. And that's the important point. This is true actually for children or adults. Whatever it is, whether it be a phobia for an insect, or whether it be a fear of going to school, a fear of talking in class, a fear of doing poorly on a test, the idea is coping skills, working toward exposure, exposing to the event, mastering the event, being desensitized, and moving on with life with confidence and knowing that one can be capable to handle these situations. And that's the bottom line with anxiety disorders, and that's a treatment approach that is proven time and time again to be tremendously effective. See you next time, Dr. C's Morning Minute.